get a little bit closer because I'm going to do your vitals, if that's okay. I'm going to start with my stethoscope. I have two. One of them is a little bit more sensitive than the other. So I'm going to start with the less sensitive one. This black one. And I'm going to take off these headphones. Oh, okay. I'm just going to yoga ball. I'm going to put you down here. I'm just going to that was necessary. I'm going to start with the less sensitive of my stethoscopes, okay? And I just want you to breathe in and out. Breathe in and out. Breathe in and out. Breathe in and out. Okay. I'm gonna have you hold a breath. I'm gonna see if I can pick it up with this stethoscope, otherwise I can change over. Breathe in and hold it and out. Okay. Okay. Okay, this is gonna go up here underneath your jaw. Can I have you open your mouth? Close your mouth. And then breathe in. Breathe out. Same thing. Open your mouth. Close your mouth. Breathe in. And out. Okay. Back to your chest, but we're starting quite high on the chest. You can breathe normally. I'm just going to listen. Good. Good. Great. Perfect. Perfect. Okay. That sounds good. Very good. Very good. All right. I'm going to get your temperature. This is going to go under your tongue, and then close your mouth. Okay, good. Now I want you to move your head to the side like this if you can, comfortably. To the other side. Back the same way. And the other way. Look up. Look down. Again, look up. Look down. Can you roll your shoulders forward? squirt. Good. And then can you move to the side if possible? Back and forth. Yes. Yes. Sybil brought it in from the mail. Cute, right? Alright. Now I'm going to take your temperature again. Ready? Same thing under your tongue. Good. That can go right there. For your blood pressure, we have this nice travel one today. Thank God, because oh my goodness, so much easier, and it's also going to give us a bit more information as well. This is going to go on your wrist, so you can just slide your hand in like this. We're going to tighten the strap, and then I'll press the button, okay? It's not as tight as the other ones. Okay, ready? Give me your wrist. Okay. Take the strap. And then I want you to hold your arm up here so that it's in line with your heart. I can help support your arm. Ready? Just relax. It's gonna start going. Okay, let me write that down. And then that got your current heart rate as well. Okay, I'm gonna take that off, okay? Alright, you can drop your arm. And then I need your respiratory rate. But I don't have my watch on me, so I'm just gonna use my phone. I literally don't have my watch on me. I know. I took it off so that I wouldn't hit anything. Okay, ready? I'm gonna stare at you while you breathe. Just don't let it change your normal breathing pattern. Or we'll have to do it again. So. Great. Perfect. Okay. Now I'm going to set up this torch, the little like eye lamp light, this guy. And I'm going to take a look in your eyes. I'd rather not use my phone flashlight for that, so we're going to get this working. This guy here, I think I can lock that in. That. Great. Alright, so I'm just going to use the light. ear. I'm gonna scoot in. Scoot, 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 scoot in. Okay. Look in your ear. Practically identical. Very good. Okay. I'm happy with what I see, to be honest with you. I'm gonna do like some more vision tests and things during the cranial nerve exam, but I just wanted to give kind of like a preliminary overlook. So, without moving your head, can you move your eyes up for me? Down. To one side. And to the other side. And can you close your eyes? I'm going to just very, very lightly press on your eyelids, okay? Ooh, I did not check inside your mouth. Let me put this back together. Can you open your mouth? And can you like actually say nice? And can you close your like teeth for me? But let me see your teeth. Good. And then can you stick your tongue out? Okay. And can you move your tongue side to side? Awesome. Okay. That's all I needed from that. I'm going to press on the sides of your nose. I can put gloves on, actually, because I'm a medical professional. These are the large size. So hopefully they'll be easier for me to put on. That is sometimes a problem. Okay. I'm going to press on the sides of your nose. I just touched my own face with the gloves on. Good. Okay, here we go. And then if I press down on one nostril, can you breathe through the other side? Okay, same thing, other side, breathe in. Great. All right, I'm going to feel around your mouth. I'm going to feel cheekbones and jaw. And your lymph nodes right here. And I'm just going to check your hairline. Anything. I can kind of look around your ears as well, like the nape of your neck. Like sometimes that could be a sign of something, but I don't see any rashes or anything like that. Okay. Would you like to take a DNA test today? Sure. Yeah. Just a cheek swab. Like this. Ready? Other side. And I can send this in, and then you'll get a full report. Is there anything you want to test for? I can put whatever I want in this box. I can do that. Oh, I can do that. I'll put that in. Okay. It's fine by me. Just gonna take out before I close this up. And then we're gonna get ready for your cranial nerve exam, okay? Honestly, we already got started. I got some of the things I needed, which is nice. Very last thing. Just checking your reflexes, okay? I'm gonna do your knees. Relax. Very good. Your other knee. Relax. Very good. Your elbows. Relax. Very good. Your other elbow. Relax. Very good. Okay. I'll gather my cranial nerve items and we'll get that started for you. Sit tight. Okay, sorry, that took me a little longer than I thought. I had to fix my hair and get all this stuff. So, I don't mean to overload you, but I do have quite a few little tests to do on you, okay? Are you ready? All right. I have a list of them, so I don't forget. I think we just need to start with your vision. That is basically maybe 3 or 4 little tests that we need to look at. The first one being this eye chart. Okay, go ahead and take a look at this eye chart. Is it blurry? Well, that's not good. You need to focus your eyes. You need to focus your eyes. Oh, now you can see it. Okay, good. All right, read this line for me. I'm not even going to bother with the first 2. Read this line right here. Okay, great. Now, if I point at this segment in the middle, can you tell me which ways the E's are facing? And this one, and this one. Okay. Here. There's going to be a few X's and O's. Can you read it for me? Good. Read the numbers on this line. Okay. Read the E's on this line. X's and O's on this line. Numbers on this line. Give it your best gander. And the E's on this line. Okay. Oh no, I'm not at liberty to comment on how you did. That's not part of the quiz. We're going to check for color blindness. Do you see any shapes in this image? What shapes do you see? Can you point them out? Okay. How about this image? See any shapes? Can you point them out? And what color do those shapes look like to you? triangle and the circle. Right. Do you see any shapes in this one? Can you point them out? Okay, there's one circle right about here. I wouldn't know, I can't see. That is not part of the vision test, so. Okay. So, I need you to look at this marker cap, okay? What color is it? And cover one eye. Here, I'll give you a little eye cup. This thing. Cover one eye with it, and then I'll have you cover the other eye. Okay? Here you go. Now, when you look at the cap of this marker, what color is it? Cover the other eye. What color is it? Would you say it's the same amount of red, or did the amount of red change? Good. Okay. Look at my nose area. Tell me when you can't see my fingers anymore. Good. 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 Alright, same thing. They're going to come into your vision. Let me know when you can see them. Look at my nose. Look at my nose. Look at my nose. Good. 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 Alright, I have to admit that was good. 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 Alright, so your vision is complete. We're going to do taste and smell kind of at the same time. Okay, I have these little paper strips. Give them a smell. They smell like paper. Great. I have sprays. And I'm actually going to prime your brain, okay? I want you to tell me, is this lemon? Okay. Is this chocolate? Is this green apple? Smell. Good. And is this peppermint? Smell. Okay. Wonderful. Can you close your eyes? Don't peek, okay? I have these tiny little jars. And I want you to just breathe normally, okay? Let me know when you can smell something. Great. And what do you smell? Okay. Close your eyes. Let me know when you smell something different. What do you smell? You're not sure, but you smelled something different. Fair enough. Okay. Last one. Keep your eyes closed. Let me know when you catch a whiff of something different. Good. That was a placebo. There was nothing in there. So if you said you smelled something, then maybe you were lying to me. Okay. Good job. Good job. Good job. Good job. For the taste, I have some dissolvable tablets in here. Don't chew it. just let it dissolve on your tongue. And let me know when the taste fades, okay? Don't take your time. If you can still taste it, don't rush it. Just let it happen. I have the timer going. Perfect. All right. Similar, but I want you to put this tablet in your mouth. Do you taste anything? Good. You shouldn't taste anything with that one. Let me know when you start to taste something, okay? Great. Not yet. That's okay. Very good. All right. Good job. I'll tell you right now, I have 3 flavors. We have sweet, we have bitter, and we have salty. I want you to tell me which one is which, okay? Here's the first one. Okay. Second one. And third one. Which one was sweet? Good. Which one was bitter? And did you taste the salty one? Great. Good, good, good. Alright. If you needed to rinse, well, you could have some of my Hawaiian water if you'd like. I'll just give you this cup. Don't drop it. Don't drop it. Hold it. Hold it. Hold the cup. Well, it's right there if you want some. I'm not even that sick. Okay. Okay. For touch, you're going to close your eyes. I'm going to poke. Okay. Poke. Poke. I don't want to do it to you yet, so you can see what it looks like. Poke. Or swipe. Poke. Or swipe your face. And I want you to tell me poke or swipe and tell me what part of your face you feel it on, okay? Alright, close those eyes. Close those eyes. Close them. Swipe on your forehead, okay? Poke on your cheek. Good. Poke on your chin. Swipe on your cheek. Good. Poke on your eyelid. Nice. Swipe on the side of your forehead. Good, good, good. Swipe on the other side. Swipe on your nose. Poke by your ear. Awesome. Okay, you can open your eyes. I have these 2. They're spiny, I would say. They're not sharp, they don't hurt. But because they come to such a point, they are very, like, it's not a very broad sensation, it's a very direct sensation. This one is a little warm. I would say hot, but it's not hot. And this one is cool, a little cold. So I want you to tell me hot or cold, warm or cool, whatever you want. But close your eyes, and I'm going to touch these onto your face. That was hot. That was cool. Yep, cold and hot. Okay, good job. Cool hot. Okay. I'm going to put them both on your face at the same time. I need you to identify where the hot is and where the cold is. Ready? Hot above, cold below. Good job. Hot on your right, cold on your left. Cold more up above, hot lower. Okay. Cold on your right, hot on your left. That was great. That's really hard. That's really hard. Okay. Now, I'm going to say some words to you. And I want you to repeat them back to me, okay? You can keep your eyes open. Arena. Good. Otter. Good. Flag. Good. Justice. Good. Playground. Perfect. Okay. Same thing, but I'm going to cover my lips so you can't read them and they're going to be slightly muffled. Are you ready? Rottweiler. Good. Fern. Good. Vinegar. Good. Ruler. That one's cheating because there's a ruler right here. But that was perfect. Good job. Alright. Getting closer. I'm going to whisper a few numbers, okay? 7, 6, 3, 3. Do you know what I said? Good. 18, 2, 5. Good, you got it anyway. Had a little flub there, so good job. I'm going to repeat the same word twice, okay? And I want you to tell me the second time, does the pitch of my voice get lower or higher? Okay, I'll say moonlight. Moonlight. Would you say the second one was higher or lower? Great. All right. Then I just need to do a little bit of your depth perception. Hold your hands palm up like this, okay? Keep your eyes closed. Let me know, what finger am I touching? Okay, I'm gonna just hold your hand. Good. Good. Perfect. Okay, same thing. Let me hold this hand. Oh, okay, ready? Good. Perfect. Good. Got it. Keeping your eyes closed, I want you to touch your nose with your left pointer finger. Now I want you to touch your chin with your right pointer finger, keeping your eyes closed. Okay, good. Sorry, I got distracted. That wasn't actually the depth perception test that I wanted to do, but those things I did want to record. It's this here. I have this string with colored spheres on it. Okay. I'm gonna hold it. Oh, come here, little guy. I'm gonna hold it kind of under your nose. Okay. Can you identify the color of the balls that you see? Yep. Mm-hmm. Which one is farther from you? Good. Nailed it. Okay. Very good. All right. Now I just need you to follow my instructions. I'm doing a few tiny little tests, okay? You're doing good? I know this is a lot all in a row. We're going boom, 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 boom. So I just want to make sure you're good. Just checking it, checking in, checking in, checking in, checking in. Okay. I have a cup here. Can you see the light? Good. All right. I want you to tell me which way the light is moving, okay? Good. Nice. Okay. Good. Mm-hmm. Good. Good. Perfect. Okay. I'm going to draw a letter. What letter was that? A very wonky X. Well done. Here's another one. What letter was that? The letter A. Very good. What letter was that? Oh, was a D. Well done. One more, okay? A W. Okay. Is my light going clockwise or counterclockwise? Good. All right. Now, this next test is by the renowned Dr. Blair. Crumpling up a tiny piece of paper here. Do a ball. Drop it in a cup. Now, we have left cup and we have right cup. Right now, the piece of paper is in the right cup. Okay, I'm gonna shake it up and I want you to tell me which cup the paper ball ends up in. Okay. Which cup is it in? It's in left cup. Very easy. Well done. Okay, one more. Which cup is it in? Righty. Well done. Yes, that is a difficult one to perform as the tester. But that's okay. I'm a professional. So, I want you to look at this because I'm very professional. I have these octopus pens. And I want you to decide on a color. So this is a decision-making test, an intuition test, and a luck test all in one. I'm going to take away one of these octopus highlighters. If yours is chosen, you are out. Don't worry, you can play again, but you are out, okay? So pick one, and tell me which one you're picking. 3, 2, 1. All right, well, I'm taking away orange. So if you picked orange, sorry. Let's do it again, okay? I want you to pick one. Pick one. Okay. 3, 2, 1. I am taking away dark pink. Purple, magenta, whatever you want to call it. That's rough, buddy. Okay. Let's do it again. Pick one. 3, 2, 1. Taking away light pink. Okay. 3 more left. Pick one. 3, 2, 1. I'm taking away teal in the middle, this greeny teal. And the last one, can you get the final intuition? Which one am I going to take away? Choose the other one. You want to win, you want your octopus to stay. Are you choosing blue? Or are you choosing yellow? 3, 2, 1. I'm taking away blue. And orange is not the winner because this is yellow. So yellow is the winner. Good job, good job, good job. That one could be stressful, so I'm proud of you. You did a great job.
Thank you so much for relaxing with me. If you are not a YouTube Premium member, remember to turn down your volume